Hey, what's up? This is Dr. Taylor Krick, host of the Autoimmune Doc podcast, and here's another awesome paper that I want to review. So I like to review papers. I have a ton of them on my computer, and in my podcast, I tend to talk about things. I try to break it down quickly and in lay people's terms. But through this YouTube channel, I'll present some of the evidence through which I come across my findings and my things that I recommend. So. This one is from the Journal of Personalized Medicine. It's from 2020, and it's called The Viral Hypothesis in Alzheimer's Disease, Novel Insights and Pathogen-Based Biomarkers. So I'm going to read the abstract. So early diagnosis of Alzheimer's disease and the identification of significant risk factors are necessary to better understand disease progression and to develop intervention-based therapies prior to neurodegeneration. So what they're saying is that we need to detect this sooner so that we can be proactive and act before neurodegeneration has already happened. Thus, it's critical to establish biomarkers that can predict the risk. A number of studies have indicated that exposure to various microbial pathogens can accelerate Alzheimer's disease pathology. So I have a few podcast episodes about pathogens and autoimmunity, infections and autoimmunity. So this is a known thing, but especially with Alzheimer's, there's several different pathogens that have been linked or associated. Additionally, several studies have indicated that amyloid beta possesses antimicrobial properties and may act in response to infection. So there's another theory that infection in the brain leads to amyloid beta accumulation that's found, in autopsies of Alzheimer's disease patients. In this review, we provide an overview of studies which suggest pathogen involvement, and we talk about it. So let's just get into it. So, the first thing that they talk about is just an intro. Alzheimer's is an age-related neurocognitive disorder. It's affecting a ton of people. It's characterized by this. And basically what it says is that Alzheimer's is a growing problem worldwide. And what we're finding is that we don't have a lot of treatments or a lot of solutions for it. So there's a lot of studies and papers coming out about this, about what are some predictive markers that could be found, what are some of the causative factors like pathogens that could be causative or at least correlative or associative, not necessarily like, the one cause, but certainly an association. So let's go down and say, so it talks about amyloid beta, it talks about what that is. So then we talk about pathogens and Alzheimer's disease. And the title of the paper is The Viral Hypothesis, but they talk about multiple different pathogens. So viral pathogens in neurodegeneration and Alzheimer's disease. The idea that infections may play a role in Alzheimer's dates back nearly 30 years and has been a subject of debate. And they go on to talk about, different infections that are associated. Like you'll see a couple things here, like here's herpes simplex virus, there's HSV1 again, HHV6, HHV7, and there's several of these. And I'm going through these quickly because we're going to look at them in a moment in a chart. Here's again HSV2, cytomegalovirus, toxoplasma, which is toxoplasmosis, which is a parasitic thing. They're associated with cognitive decline, and they just go through some of these studies, some of these papers that are showing this. And again, I'm going to show you some pictures and a chart that really help too. Talk about HIV. Pathogens such as viruses enter the brain at levels which exceed the capacity of the innate immune system in the brain. A number of different viruses have been shown to enter the brain and cause neurodegeneration, often with accompanying proteinopathy. For example, talking about bird flu, So here's a picture that's really good, and it talks about 1, 2, 3, 4, 5. So 1 is the pathogen enters the brain. So somehow this pathogen gets into the brain. 2, amyloid beta binds the pathogen and initiates an immune response. So again, that amyloid beta has some antimicrobial properties, so it responds to and binds to that pathogen. So 3, it's formed, it surrounds the pathogen. The plaque activates microglia, which releases inflammatory cytokines. So microglia, you have about 100 billion neurons in your brain. Microglial cells outnumber neurons 100 to 1. So you have quite a few microglia, and they are the source of a lot of neuroinflammation. Microglia get primed, they get turned on, they release cytokines. They also can act as antigen-presenting cells, variety of things with this microglia activation. And then 5, neuronal death, leading to neurodegeneration and Alzheimer's disease pathogenesis. And I've heard it said that with neuronal death, you lose quite a few neurons each day. And I've heard it said that sculpture is fine. You chip away a few neurons each day. That's fine. That's expected. That's a normal part of aging. You don't want your brain to be like ice sculpture where it is melting away and you're losing neurons at a faster rate than what's normal. So let's keep looking down. An intriguing idea is the multi-hit or the hit and run hypothesis. I talk about with autoimmune that in general with pathogens, it's not one pathogen or infection, but rather the burden of pathogens or infections throughout your lifetime. So it talks about some of the theories there. Yeah, and let's just go on. So bacterial pathogens, this is pretty interesting too. It talks about periodontitis caused by Porphyromonas, which is an oral pathogen. It says Porphyromonas is shown to release cytokines into the bloodstream, elevate C-reactive protein and inflammation, and is associated with Alzheimer's disease. Some of the others that you might just see in here, let's see, chlamydia pneumonia, Borrelia, that's Lyme disease, gut microbiome dysbiosis and altered microbiome composition have been implicated in Alzheimer's disease and various other neurodegenerative disorders. So they talk about these different bacterial infections and bacterial imbalances. And then they show a picture down here too, just saying that gut microbes can cross the gut lining in a leaky gut, get into the bloodstream, and then cross the blood-brain barrier. They say that when you have a leaky gut, you likely have a leaky brain. Leaky gut equals leaky brain. Gut on fire equals brain on fire. These are common sayings. And so there's a role of bacteria here as well. Then it talks briefly about other pathogens. It talks about fungal infections, which I think are important for neuroinflammation, olfactory dysfunction in Alzheimer's disease. Then it talks about biomarkers. So these are lab tests. These are things that can be predictive or be diagnostic or just be measured. It talks about antimicrobial peptides. And then below this chart, it talks about antibodies. Then this chart is showing those things. So these are some of the antimicrobial peptides that can be measured. And these are some of the antibodies. And these are interesting. So like an IgG against Epstein-Barr virus, it correlates with the development of mild cognitive impairment. Antibodies against chlamydia pneumonia, antibodies against HSV2, they correlate with certain forms of dementia or with cognitive decline or cognitive impairment. IgG against cytomegalovirus, IgG against toxoplasmosis, IgM against HSV1, so a reactivation of HSV1, IgG against H. pylori. Others, here's your fungal, your gut microbiome, your Porphyromonas. So they're talking about how these antibody markers, which are readily detectable in the blood. I talk about them in my podcast episode number 22, talking about the Cyrex Array 12 and measuring these IgG or IgM antibodies against infection. So these are associated. So antibodies against pathogens are readily detectable in the blood and may be a reasonable way of establishing risk. Now, risk is not the same thing as it's going to cause or anything like that. But again, if you see these, what they're saying is that it raises the risk. So IgG antibodies against HSV2, cytomegalovirus, toxoplasma have been shown to correlate with cognitive decline, and etc. So this paper goes through this. I'm skimming it. There's other things in here that you see. Fungal polysaccharides, fungal DNA have all been detected in blood samples drawn from Alzheimer's patients. So again, even for me, it's hard to get off of this because there's a lot of interesting stuff. The point is that there's an association and that the lab values that I talk about in the podcast episodes matter. And when you have some of these lab values, it doesn't guarantee, it's not a death sentence by any means, of course not, but it at least raises your risk. And when we look at all the different risk factors, smoking, diabetes, stress, obesity, and viral burden, that is a risk factor, and the evidence supports that. So, hope that was helpful.